Ask any woman or man on the street to name just one symptom of menopause. What you're likely to hear is hot flashes, one of the most devastating symptoms that could be avoided altogether if we just knew some of the early warning signs. So, can we avoid the dark side of menopause altogether? That's today on Second Act TV. Dr. Laurie, thank you. I'm so glad you're here. As most of our viewers know by now, that you are a anti-aging and hormone specialist.
Right.
Yes, you're the founder of An Optimal You, and I'm happy to say my personal physician. So thank you for being here and
You're welcome.
helping us, decipher some of the misnomers, let's call them, on menopause. You're saying, we say the word menopause, the men cringe,
Right.
I mean, it's like this is the beginning of the end.
Right, it's like the worst thing possible.
It's the worst thing, but you're saying that this could be the best time of your life. What do you mean by that? Tell us about that.
It should be the best time. You can't get pregnant, so don't need to worry about pregnancy. Usually people are in long, wonderful relationships, and even if it's a new relationship, we're more mature, so they're more meaningful relationships. So really it should be the best time. You should feel great, you should enjoy the sexual relationship, you should enjoy the mental relationship. It should be fabulous.
No, it should. It should.
Yeah.
But then why isn't it? Why,
Yeah.
I mean, we have horror stories about menopause. It just
Right.
has such a bad, horrible connotation. How do we avoid it?
That's a great question. A lot of answers, but really it comes down to one, women and men both, paying attention. But we'll talk about women since we're talking menopause.
Right.
Get help. First look at hormones, because hormones, when they're out of balance, they can affect your mood, so that you're bitchy. Nobody wants to be with you, and nobody wants to be around you. You're like the grizzly bear,
Yeah.
And then also just to feel good, to feel vital, to feel active. Okay, so really getting the hormone balanced I think is a key, and then the other key obviously is relationship issues, communication.
Well, how do you know though? What are the early? Like we talked about the early
Right.
warning signs. We talked about at the top of the show here, hot flashes. By the time you get to hot flashes, you're suffering already. What
Right.
are some of the early signs that you're heading into menopause? That if women knew about this, they could go to their doctor and get tested.
Okay, I see what you're saying. Before you before you know you're in menopause.
Right. Let's avoid it.
Okay, so really that's the perimenopause time, and that could start as early as 35. I've even seen below that these days.
You brought up a good
Yeah.
that's a good term. What is
Okay.
perimenopause? Let's talk about that just briefly so our viewers know what that means.
Okay, basically perimenopause is simply the time before you go into menopause, and it could be a year, it could be 5 years, it could be 10 years, it just depends. And it's the time when your hormones start to get out of balance, where you have symptoms, but menopause is a year with no period. So until you don't have a
Okay.
period,
So that's
It's
the
not menopause.
definition.
Right.
A year without period.
Right.
Without a period, and that means that you're
Right.
in full-fledged menopause.
Exactly.
Okay. So these symptoms, the early symptoms in perimenopause.
okay. So what a lot of people notice, especially in their 30s, is they'll start noticing like PMS symptoms, or hormonal imbalance, fatigue issues, mood issues, depression, anxiety. That's what you see a lot,
Okay.
and people don't think about hormones.
Well, and but people that sometimes, I mean, you're just depressed or you're irritable. What's the difference between just normally being bitchy and hormones?
Right. Good question. Well, there are people who are clinically depressed, who suicidal, those issues. I'm not talking about that, but I'm talking about where you just irritable at things you normally wouldn't be. You think about who you were in your 20s, and then you get into your 30s, into your 40s, and you just know you're not yourself. Maybe it's different for everybody. Does that make sense?
It does. It does. And when I think back on it, you all of a sudden you just got upset about things that you didn't get upset about.
Exactly.
But not being even thinking about that it could be menopause. You start to think like you're going crazy.
Exactly. Another thing I see is women start getting palpitations, where their heart races a little fast. And I have had so many of my patients that have gone to the cardiologist, gotten worked up. They said, you're fine. Maybe give them Prozac because they think they're crazy.
Yeah.
And truly it's hormones.
Wow. Wow. So you go into menopause. So at what point do you get tested and do something about it?
You know what? I would suggest that the minute you know you're not right, that something's just off. Maybe you're a little more tired, a little less energy, a little more aches and pains. That's another thing people don't think about, are aches and pains. They just think it's normal. No, you should live well, die quick.
It
later
is so
in life.
good to hear that that's not normal.
I mean, it's typical because of our society,
Yeah.
but it shouldn't be normal.
Okay. So you go, you have your hormones tested, and how is that typically done?
So typically there's different ways you can do it. I prefer blood. It's inexpensive, it's easy.
It's normally covered by insurance.
Exactly. And because typically bioidentical hormone replacement and good hormone replacement is not covered by insurance. So I try to do lab work that is covered. So the blood work typically is covered, and it's just as accurate.
Okay.
And really it's talking to somebody, getting their questions, you know, finding out what their symptoms are and tailoring it to them.
So really, getting on some sort of hormone replacement
Right.
as early as possible is the key. And of course, that opens up a whole new can of worms about
Right.
what, you know, the synthetic and bioidentical, which we'll cover in another show.
Okay.
Well, again, to sum up for our viewers, what perimenopause, some typical symptoms
Okay.
that you can pretty much attribute that you're heading south.
So basically, when the signs that you need to know to get help, I would say fatigue is a big one. Sleep issues, sleep disorders, mood disorders, irritability, anxiety, depression, not recovering from workouts as well, not having more aches and pains. Those are probably the big ones. Obviously, when you get into hot flashes and night sweats, you guys know that. But
you're
the
already-
early,
yeah. So once you're into hot flashes and just your severe depression, mood swings, that sort of thing,
Right.
definitely get help at that point because there's
Exactly.
help out there.
But why not start early and sail into menopause and have it be the best time of your life?
Oh, I love that idea. Well, thank you. That's really great advice. And obviously, we're going to be back. We'll have Dr. Laurie back for many more segments to discuss really what are our options. The big issue of synthetic versus bioidentical, and are men effective with hormones? All this will be coming up in future segments of our second act. Thank you.